Hey everyone, Julien here, nurse practitioner for Dan Aesthetics Medical, and today I'm happy and honored to speak with Lynn from Pennsylvania. Amy is a registered nurse. She started her own clinic, Glo Derma Academy, in 2016, and that was only 2 years after she started taking her very first injectables course. She's been killing it ever since, and she was actually one of the top speakers on Inside Aesthetics podcast. I ended up checking out her page, looking at what she does. She does great work, and she does a lot of biostimulators, which is kind of like Sculptra, Radiesse, and stuff like that. And I saw that she was also doing areas that I wasn't doing. So she was doing décolleté region, and I'm going to bring her in, and we're going to be chatting all about that. Hey, how's it going? Good to see you too. So I reached out to you because I saw the topic of Sculptra, hyperdilute radiesse. Like whenever I end up going to MCAS in Paris, whenever I go to these things, I'm hoping to pick up like a few good golden nuggets, and then after that, kind of working with it. And then they ended up having kind of like this slide presentation on Sculptra, and what they showed was basically over 10 years, the clients that we're doing weren't really developing jowls or nasolabial folds. And yes, we are kind of filling a little bit in the pre-gel sulcus and also nasolabial fold too, but basically the idea was that it's likely adhering from the fat pad to the muscle, and it's keeping it in place, so it prevents the drop. And I was floored by that, and I didn't know, for some reason my mind didn't click to that, and that has been sticking with me ever since. I've been telling all my clients about it. And then as I just kind of like stumbled into your page from Inside Aesthetics podcast, I ended up checking it out. I saw that you're doing like Sculptra at the chest area. I was like, man, that's so cool. I'm not even doing that stuff. And then I ended up reaching out to you, and you're like, yeah, totally. All of my clients basically right now, they don't get away without getting some type of Sculptra treatment.
I love it.
It's definitely a niche thing. In Ottawa, it's starting to pick up. And the reason why is because people are afraid to look puffy. And particularly since Madonna ended up going up and people are like terrified of that, they're just kind of wondering what else is there. And now people are starting to come on board with the Sculptra treatment. So it takes a little education. This is one of the reasons why I really want to get this Instagram Live going, because I really want to get people to understand the benefits of these collagen stimulating fillers. I know that we're in a society where like instant gratification is great, but if we can maybe get better results by introducing other modalities and have a little bit of a waiting game, then, you know, it's definitely worth it.
I would say even when I started practicing aesthetics about 8 years ago, even in my own immediate area, it was, people knew what it was, but they weren't really that familiar or comfortable with it quite yet either. And I always bought into the idea of Sculptra because I love that like nice, natural, progressive rejuvenation, as well as improved skin quality. And it's like just an overall just really beautiful look. It doesn't take the place of HAs, but it definitely helps with that support to have to, you know, not necessarily use so many of those fillers, like hence to your point, like Madonna, the puffy face, that overdone look. So it really is a nice complement to some of our HAs and makes us not necessarily have to use as much. I would say now finally, I believe that Sculptra is getting the respect that it deserves. I think now because our industry is growing so much and more people are, you know, interested in getting these type of treatments, but they also don't want to necessarily look fake. And it's fitting more of this really, you know, diverse kind of crowd now who are seeking out these treatments from, you know, all over the place. That I think now they're understanding what Sculptra does and what the benefits are, and that they can really, really benefit and get some natural, beautiful results from it.
Who are you recommending to get Sculptra? Is there an age limit, or is there like a minimum? Like, what's your cutoff?
I start recommending my patients even starting in you know, their 30s, and even if they're just doing one vial a year, I call it like, you know, their birthday Sculptra. That's going to prevent them from being depleted much more compared to somebody who's maybe in their 60s who has never had any sort of procedures like Sculptra. So I like to recommend for some preventative, like pre-rejuvenation measures to start in their 30s. They may need one a year, they may need two a year. They may follow that proper protocol that, you know, was created about one vial per decade of your age, but that's not necessarily always the case. So I like to start, starting in the early 30s is ideal because it's just going to prevent them from requiring more later on. And then as far as the cutoff, it really, I had this question asked to me this past week when I was in Atlanta, and it's a great question because it's really patient dependent. So their lifestyle choices, their diet, have they been taking care of themselves, or is this something that is completely new? Of course, somebody in the later mature decades, 60s, 70s, and so on, their collagen production is much lower than somebody in their 30s, to say. So it really all just depends on their lifestyle. I feel as far as how they're going to react and basically have a great result with Sculptra.
When you're doing your Sculptra, for most people, you're doing just one vial for the full face. You're doing
I change it up. So I'll space it out. So let's say somebody's in their mid 40s, and we are estimating about 4 vials would be the best, and then we will maintain after that annually. Then I'll do 2 vials, wait about 4 to 6 weeks, do the next 2, and then we'll just kind of watch how everything is evolving over the next 6 months or so. And then maybe if they're on that cusp and they're really, they have a lot of fat loss and a lot of collagen loss, and they're really, losing a lot of that, facial fullness, then maybe we'll top them off with a 5th vial at that 6-month mark, so we can be in a little bit more control of the process.
How are you using it? Do you use it like kind of deep, superficial, into the skin? How are all the ways that you're using it right now?
I prefer the Sculptra, if we're talking face specific, more in the frame of the face, the temple area, preauricular, jawline, and then piriform. You can also put it in the lower face as well. It all also depends on muscle movement, in my opinion, because if someone is really hyperdynamic in the lower face, and then you're injecting it close because everything's so tight down in the lower, aspect of our face to the muscle, it can cause potentially some little clustering. I wouldn't say they were like nodules or anything like that of the particles because of that stimulatory factor to it. So I think it's like a home run right back in the frame. You're kind of framing out the face, giving it some beautiful support, even back in the hairline. And then in the front, we're doing a little bit more of that highlighting with some of the fillers if we need to. You don't want to put Sculptra where there's a ton of muscle activity for that reason.
So some people have questions or concerns about Sculptra because they do hear like the Sculptra nodules that happen superficially.
Sure. Any underlying concerns that, maybe in the immunity process has anything compromised or so on and so forth. I think knowing that is key. I also think the dilution is key and preparation of it is key. I think the thing with Sculptra too that people were unsure about before was how long do you have to prep the product? Do you have to have it sit out for a week? Is it 2 weeks? Is it a day? Is it 3 days? Like we used to do some crazy things. Do we have to warm it up first? Do we have to, jump upside down, shaking it like crazy? And what they actually did a study that showed that immediate dilution or reconstitution and 2 injection had no difference. The immediate to 24 or 48 hours to 72 hours, so on and so forth, under a microscope as far as how the particulates integrate with the diluent. So that was pretty interesting. So I think the fussiness has gone away. And then also just diluting it the proper way. I typically stick to about a 9 cc dilution when I'm injecting Sculptra. I think that also helps. And I also think that knowing your anatomy and the planes for injection is also key too. And that will avoid any sort of those type of nodules from forming. So if you kind of check all those boxes, I think that also post-care is really important, the massaging afterwards. I really do believe in that. Some people will say, what's the point? I like to really encourage my patients to follow that rule of 5 times a day of massage for 5 days for 5 minutes to help really encourage that dispersion of the collagen and the diluent so the particles get to where they need to be. So those are some easy areas to avoid. I haven't really come into any sort of, thank goodness, I know I'm like, now I'm jinxing myself by saying that, any complications as far as from my end. I have seen patients who have gotten, Sculptra maybe a long time ago, and it has gotten stuck maybe down in like the DAO area that's a little congested. It's not visual to our eye, like from the exterior, but they can feel it inside their mouth sometimes. That can just be a little annoying to them. But as far as, any sort of like, it's just a regular thing that happens, it's not. It's like anything.
So for me, I love doing these Instagram lives because I get to connect with all these top providers in the industry who are like-minded. And whenever I get to go to these major conferences, I get to meet them in person.
Yeah, like you said, the relationships and the networking, and you just learn so much about what is going on globally, and it kind of steps you out of your market. You get to connect with some fascinating, brilliant, other providers that are like-minded like yourself. And it's a great, great time. Thank you so much, Dan. It was so
So
great.
I'll see you there. Thank you so much for doing this, Amy.
Thanks for joining in.
It's amazing.
Okay, bye.